Hello dear friends, how are you doing today? I hope you are doing well. Welcome to a new question about dermatology. A 26-year-old male presents with a rash. Examination reveals erythematous oval lesions on his back and upper arms, which have a slight scale just inside the edge. They vary in size from 1 to 5 centimeters in diameter. What is the most likely diagnosis? A. Lichen planus. B. Guttate psoriasis. C. Lichen sclerosus. D. Pityriasis rosea. And E. Pityriasis versicolor. Okay, this question is asking about here we have a 26-year-old male coming with a rash. On examination, we can see erythematous oval lesions on back and upper arms of the patient, which have a slightly scale just inside the edge of the lesions, and this presentation is important in patients with Pityriasis rosea. We can see lesions with a slightly scale inside the edge of the lesions. They vary in size from 1 to 5 centimeters in diameter. This question is asking about the most likely diagnosis. As we said, the most likely diagnosis is Pityriasis rosea. Here we are going to explain it. The skin lesions seen in Pityriasis rosea are generally larger than those found in guttate psoriasis, and scaling is typically confined to just inside the edge of the lesions. Pityriasis rosea describes an acute self-limiting rash that tends to affect young adults. The etiology is not fully understood, but it's thought that herpes hominis virus or human herpes virus type 6 and human herpes virus type 7 are responsible for Pityriasis rosea. Features of Pityriasis rosea: we can see Herald patch, usually on trunk, followed by erythematous oval scaly patches which follow a characteristic distribution, with the longitudinal diameters of the oval lesions running parallel to the line or longer, and this may produce a fiery appearance. Management of Pityriasis rosea. Pityriasis rosea is self-limiting and usually disappears after 4 to 12 weeks. As we can see here, we can see a typical Herald patch with a slightly scaling in the edge of the inside of the edge of the lesion. After a few days, a more generalized fiery rashes appear on the surface of the body of the patient. Here we can see also Pityriasis rosea with a fiery appearance on the back of a patient. Differentiating guttate psoriasis and Pityriasis rosea is important. We talked about Pityriasis rosea and guttate psoriasis, the differentiations and the presentations and management in our YouTube videos. For more information, you can watch them. Thank you for your attention.